Experts at the University of Edinburgh have made a breakthrough in our understanding about ME and chronic fatigue syndrome conditions, estimated to affect more than 50,000 people in Scotland. The study found significant blood differences in those with the condition, including signs of long-term inflammation, blood sugar issues, liver stress. Let's speak now to Dr. Sjoerd Beentje from the University School of Mathematics, and also to Karima Rahman, a volunteer for ME Action Scotland. Morning to you both.
Morning.
Good morning.
Dr. Beentje, just tell us about this study and what you discovered.
Yeah, so this is the largest study in its kind of blood measurements between people with ME and without ME. We found significant and large-scale differences between the two groups. One other thing we investigated is that people with ME are often less active due to the symptoms, and others in the past have proposed that this might cause some of the differences observed, and in fact we found no evidence whatsoever that this is the case.
Okay, and what do you think this could mean then in terms of understanding these conditions more?
So one thing our evidence points at is that ME is very much a condition in the blood, and perhaps previously held perspectives are not quite the case. So it's really not due to inactivity, and we hope that this helps with problems where individuals are disbelieved of their symptoms. So importantly is that ME is a female-biased disease. There are far more females with the condition than males. The ratio is estimated to be 3-to-1. Interestingly, we found no differences in blood measurement differences between males and females.
Okay. Karima, when you see the results from this study, what does it make you think?
It's really exciting to hear about the research. You know, a diagnostic test potentially would be such a game changer for people with ME. So it sounds very hopeful.
And what is it like to just describe to people who don't know or don't have anybody in their life, what is it like to live with ME?
Yeah, so ME is short for myalgic encephalomyelitis, and it's an energy-limiting disease that affects multiple systems in our bodies. So one way that we tend to describe it is it's like when you've got a broken phone battery, and whatever you do, it doesn't charge up to 100%. It can suddenly drop or go flat, even if you've barely done anything. And so for me personally, that leads to a lot of fatigue, headaches, nausea, dizziness. I'm only able to work part-time, and I have to constantly think about my energy levels, and that's as someone who lives with a mild version of this condition. So for people who are severe, very severe, they can be fully housebound, bedbound. So it's really serious.
And Dr. Beentje just there was saying how these findings then about these blood differences, it helped to support the case that it isn't, it isn't all in the mind, it isn't anything to do with that. And how much of a difference do you think that could make?
Definitely, that could make a huge difference. So it took me about 5 years of going to my doctor to get my diagnosis and get to that point. And I was told that it was due to deconditioning. It was due to me not doing enough because the tests kept coming back clear. So I kept getting told everything's fine, or it was due to pre-existing mental health issues. And what that means is you keep pushing on and you make yourself more ill. And that's really common for people with ME, to be dismissed, disbelieved. And in the end, the only reason I got my referral to a specialist was because I went and saw a psychologist privately who wrote a letter saying, actually, this isn't mental health, you need to look into it. That was what they took seriously. So a diagnostic test could have potentially changed all of that. But the thing that I'm also thinking about is there's very little support in Scotland currently. So we all manage it without healthcare professionals generally. So as we improve diagnosis, that'd be incredible. And then what we want to see is also improve specialist support to make sure care is there for people living with it.
And Dr. Beentje, just then, how close could we be then potentially to a diagnostic test?
So based on the results of our work, we're not quite there yet, but it certainly indicates that this may be possible in the future. So in future work, we're pursuing this.
And Karima, at the moment then, what kind of treatments are available to people living with ME?
Very little for people going through the NHS. And as was kind of referred to earlier, it's been founded on models that now this research helps show aren't true. So practices like graded exercise therapy, which are extremely dangerous for people with ME, and ask them to keep increasing their energy levels. And actually, this shows us that it's not about that. It's not about the amount of activity that you're doing. There's something truly wrong with us in our blood. So I really hope this could potentially lead to more treatment, because right now there's very little.
And that frustration that you talk about almost having to fight to be believed, do you think the attitudes are changing slightly, Karima?
I think so. Obviously slower than we would like, but sadly we've seen vast numbers of people join our ranks following effects of COVID. And, we would never ask for that to be the case, for the condition to get more attention. But I think that has helped us get some more sort of research and attention to it. So I think people are beginning to understand more that this is a real thing that really affects tens of thousands of people's lives.
Well, thank you both for coming on this morning. That's Karima Rahman. They are a volunteer for ME Action Scotland. And we also heard from Dr. Sjoerd, Beentje, who's from Edinburgh University's School of Mathematics, one of the teams behind this study into the blood differences with people with ME and chronic fatigue syndrome.